So now I'm assessing the oculomotor nerves first. First, at rest, we are assessing the width of eye slits. Yeah, whether they are similar. You're not going to make a video. Oh, okay, you're on. So they are similar on both sides. Okay, now I'm taking the neurological hammer and asking my patient to follow the hammer with eyes only. So follow the hammer with eyes only. Do not turn your head. Do not turn your head. What's wrong with your? Continue to follow, please. You have difficulties with your eyes? The problems? Okay then, follow the hammer. Do not move the eyes from the hammer, from the target. So the range of motion we are assessing, the presence of nystagmus. Now I'm assessing accommodation, so the reaction of pupils to the enclosing of the, enclosing of the, what is that movement? The target is getting closer, there is an accommodation, and the reaction of pupils is constriction. Okay, next thing, pupils, pupillary light response. First is direct pupillary light response. So I'm using the torch to light the left eye, and I see the direct light response of the left pupilla. Then, in response to lighting the left pupilla, there is a constriction of the right pupilla. This is a consensual light response. Yes, both, of course, it should be myelinosis. So, again, this is direct. I'm lighting the left, and it's constricting. And this is consensual. I'm lighting the left, and I'm assessing the right pupilla, right? Then, the other one, light to the right eye, it's constricting. This is normal direct light response. When I'm lighting the right and assessing the left one, and it's constricting, I say that there is consensual light response. Okay, next. What, sorry? Everything's fine? Moving on to the fifth nerve. So this is sensory. No, it's trigeminal.
50 is sorry, 70.
Yeah, so I use this pin, and I'm asking the patient, can you feel that?
Yes, ma'am.
Is it sharp or dull?
Sharp.
Okay, and here, is it sharp or dull?
Sharp.
Is it the same on both sides? Okay, so I'm assessing the pain sensation on both sides. Can you feel that?
Yes, ma'am.
Similar? Okay, great. And here, and here, is it the same? Is it sharp? Okay, so 3 branches, yeah, of the trigeminal nerve. Then the Zeller zones. What are the Zeller zones? These are these zones which are for each level of trigeminal nerve. Can you feel it all the way from the ear to the nose, and it's all the same? Nothing changes. And here, all the same. Okay, you may not do this like we do in real life, yeah, just show that you are performing this action. So can you feel that?
Yes.
Is it the same on both sides? Okay, great. I mean, all the way from the ear to the nose. So the Zeller zones are fine. Okay, the next part for fifth nerve is mastication. Yeah. So please chew. Chew. Several movements. Yeah. Okay, great. And temporal. Yeah, chew again, please. So muscles are similar on both sides. Muscle tone and strength. Next, facial nerve. We say that the face is symmetrical. Yeah, and now we are assessing all the levels of the upper, the lower muscles of the face. So please raise your eyebrows. Raise. No. Raise eyebrows. Make a surprised face. Surprise. Did you have Botox injection before? Yes? You have Botox?
No.
Yes, this face. Like surprise face. This is raising eyebrows. Then
Well, if a
frown.
patient-
Make an angry face. Yes, okay. Now close your eyes tightly. Tightly. Okay, great. Open them. Please smile with your teeth. Now puff your cheeks. Puff your cheeks. Okay. Pout. Okay, great. So you see the facial movements are symmetrical, yeah? Okay. Now open, yes.
Can you check my olfactory nerve?
Yeah.
Maybe later we are making a video. Then after that, yes, I will. Okay, open your mouth, please, and say ah.
Oh.
So I'm assessing the back wall of the pharynx and the
Autophonics.
Soft palate.
soft palate, yeah, whether it's symmetrical or not. Then the uvula, it should not deviate anywhere. Yes. Then the sound, you said. Yeah, there is no nasolalia, I would say, no hoarseness of voice. We also assess whether there is hoarseness. Then I give the patient a cup of water, a glass of water, and ask them to make a sip. Yeah, and assessing the deglutition function.
Yes, ma'am.
If he's not coughing and there is no nasolalia after swallowing, we can say that everything's fine with deglutition. Then I take the paper tube. I'm not doing that. I'm just saying that, yes? And you don't do it as well. So make a tube out of this paper or use the tongue depressor and again touch the back wall of the pharynx. And you see the gag reflex. Yeah, the
Yes, ma'am.
muscles are contracting. Yeah, some patients might even have something like
Vomiting.
not vomiting, but
Sensation, feeling of vomiting.
yes, this is the gag reflex. Next is what? The tongue, the last, 12th. We may assess the 11th, but it's not there in your Osce's. So show me your tongue, protrude your tongue. So you see there is no deviation, no folding, no fasciculation, so it's normal.
No.
And there is no dysarthria. Fine, so this is probably everything about cranial nerves. Come on.